Hi, my name is Jacqueline Overby. I'm the Executive Director of V for Victory, and we are a local nonprofit that supports families in Jacksonville who are battling cancer. One thing that's incredibly unique to us as compared to other organizations is we serve adults and children who are battling cancer. We serve the whole family, and it can be any cancer diagnosis, any age.
Hi, Justin Moore, General Manager of George Moore Chevrolet, off of San Jose Boulevard in the Miramar area at V for Victory with Jacqueline. Jacqueline, what is V for Victory?
Hi, I'm Jacqueline Overby with V for Victory. We are a local nonprofit that serves families who are battling cancer. One thing that is very unique to us is that we serve adults and children who are battling cancer. We serve any diagnosis, any age. We provide everyday direct services to families. So if a family is in treatment and needs lawn care, if they need cleaning services, a haircut, maybe a home repair or car repair, we step in and pay for those services for them.
How did it start?
We were started in 2017 by a local business owner, the owner of V Pizza. His son was diagnosed with cancer, and they really got a firsthand look at the impact that cancer has on your everyday life, and that there are so many people in the Jacksonville area who are struggling to provide services, to keep up with some of those everyday needs in their households while they're undergoing treatment. So he created this charity, and that's what we do. We are the neighbor, the friend, the person who steps in the community and helps out a family in need.
How does a family find you?
So we have incredible relationships with all the social workers at the institutions and health care facilities around Jacksonville, of which Jacksonville has quite a few great cancer specialists, and we get referrals directly from social workers. We get referrals from families, from V Pizza staff. They're always referring people into us. It's just a little bit of everything about how people hear from us.
Is there a criteria to qualify?
So we make it incredibly simple for families. Families have a lot going on right now, and we want to make this process as easy as possible. A family submits an application. We do a full vetting process. We connect with their healthcare institution and their social worker to verify their diagnosis, their end of treatment date, and then we start serving them.
Now, when you say we,
Yes.
who's we?
So we are an incredibly small but mighty team. It's myself. I have one other staff person who's on full-time, Caitlin. She is my right hand. I could not do this without her. And then I have a wonderful part-time individual, Chrissy, and she helps me with outreach. A big part of what we do is reaching out to the community and bringing in people who want to partner with us. So we work in a really unique way from other organizations. We connect with businesses around Jacksonville who can provide just one service a month at a discounted rate. That one service is then paid for by V for Victory, and the individual is able to access whatever it is they need. So if you pay $1 into V for Victory, instead of paying dollar for services, the businesses are giving us a discount, so we are able to stretch every single dollar twice as far.
How would a family find you?
So you can find us through our website, vforvictory.org. You can also check us out on Facebook, V for Victory Jax, J-A-X. That's where we can really keep you up to date on all the services we're doing for families, day in and day out. But also all the social workers should be referring families directly to us. We have really great relationships with all of them.
How did you get started with V for Victory?
So I started with V for Victory in 2019. My family is medically complex. My son is almost 4 years old and he has some health conditions. Cancer is not one of them, but it really gave me insight into what a family struggles with when they're spending countless hours and days on end in the hospital, when you're researching a diagnosis that you know nothing about and you're trying to learn all these medical terms. Having other siblings and children in the household, trying to keep up with meals and laundry and lawn, it just becomes incredibly overwhelming, and for our cancer families, it's very isolating. I was approached in 2019 by a friend of a friend, and it was just a couple weeks after my son's open heart surgery, and the timing lined up perfectly. I knew I wanted to help families who were in medical crisis, and I haven't looked back since, and it's been an amazing last couple of years.
What was your background prior to helping families?
So I have always been in the social work field. I have my master's in clinical social work from NYU. I've done everything from policy development with the United Nations and Amnesty International to direct service working and developing after-school programs for children. So I've kind of gone the whole gamut, but my personal experiences really led me to find this place as being the perfect fit for me.
So you were a social worker in New York City?
I was a social worker in New York City, yes.
I bet you got some stories.
I do. Yeah.
So, I forget the term. It's a great term. It's something about emotional exhaustion. And
Compassion fatigue. Yes.
how did you handle it then? How do you handle it now?
I think that everyone has to find their purpose, and if you aren't connecting with something within yourself, then you're going to burn out. You're going to have that compassion fatigue. Being able to find a purpose, knowing that what I went through and my family went through is now giving back, is actually incredibly healing for me. It is important to be able to step away. It is important to find things that you can connect with outside of work, because when you're seeing the struggles that so many families are going through every day, it can weigh on you very heavy.
How does this compassion fatigue compare to social working in New York City?
Most of what I did in the social work field in New York City was more at a policy level. So I didn't experience that same level of compassion fatigue. I did some clinical work,
Okay.
and it was rough because you saw a lot of abuse and it was just different. It's a different beast. Most of what I did was in policy, and I felt so disconnected. I just didn't feel like I knew I was making an impact, because if you can change a program, if you can change a policy, it trickles down. But I didn't get to see the people that I was helping day in and day out, and I missed that. So returning back to that grassroots, and we are very grassroots, serving right on the ground.
Yeah, I mean, you get in my mind, when I was making assumptions, unjustly, it was like, when you're a social worker anywhere, I feel like you're evaluating a situation more and can't have that immediate impact on maybe that family or that household. And when you say policy, okay, well, that makes a lot more sense to me. In this, it's like you're seeing a child right after treatment, but you're also making them smile, which is, because, yeah, I mean, another thing's like, so my best friend's oldest daughter was born deaf, and I learned a lot through that experience, because it's like deaf or cancer, it doesn't know race, social equity, anything, and all of a sudden you're in a group with not your neighbors, but anybody else dealing with that. So a lot of these kids, I mean, maybe it's the first new toy they've ever had.
Yeah, so this project, Project Lego, is pretty incredible because it does have such an incredible impact on the families in ways that I didn't imagine. So you talk about making assumptions. I came in with assumptions on how this project was going to work, the impact it was going to make, and it's looked completely different. So the project is connected, it's for pediatric oncology patients, and it's designed to give them something positive to look forward to. It's to change that narrative from you're going to the doctor and you're scared, you can't eat, you can't go to sleep because you're scared of being poked and prodded and waking up sick the next day from treatment, to when can I go to my next doctor's appointment because I want that really cool Avengers set that I saw at Lego. It just gives a whole different perspective, and research has shown that there are positive outcomes for children and adults who have something positive to look forward to. So that was the expected outcome, was that we knew that would happen. But what we didn't expect is to have doctors and nurses in the hospital coming up to us saying that Legos have provided an icebreaker when they walk into a room and the kiddo is on the bed working on Harry Potter set instead of watching TV, and now they can come in and just start talking about Harry Potter. And next thing you know, they've already done their exam, they're out of the room, and the kid never experienced that anxiety that is around traditionally a doctor coming in. We didn't expect our adult families to love Legos as much as they do, and to say that it keeps them occupied while they're spending hours in the hospital with their kid. They can sit there with their kid and work on the Legos with them. It has provided a neutral icebreaker even within a home. We had one family who she wasn't able to talk to her kids about what she was going through. She had been battling for about 6 months, and the word cancer had never come up in their house. And her kids were 10 and 12, and they received a Lego set and they were working on it together. She was really sick, and she could, just sort the pieces and still be present with them. And when her daughter started asking her questions about, why are you losing your hair, or why have you been going to the doctor so much, they were finally able, after 6 months, to start having a conversation about that. All of our funding, 90% of our funding, comes directly from the community. Individuals in the community make a donation, mostly at a V Pizza restaurant, on your receipt. If you see there's a charity tip line, would you like to make a donation to V for Victory? 100% of that donation comes to V for Victory, and that then goes straight into paying for those services, paying for lawn care, paying for home cleaning, a car repair, whatever it is a family needs. That's how that is funded. Our administration, this space was actually donated, but any admin costs, my salary, paper, whatever we need to keep the lights on, that comes from the board of directors. So the community doesn't pay for any of that. So in the future, I see every community that a V Pizza is in to have a V for Victory, to be that V Pizza. The donations that are coming through that V Pizza, the donations that are coming from the community, are going back into the community.